I'm not sure where I was at, but just wanted to say thank you for the opportunity to present on our work on the Alliance-supported contact mission. And our project was focused on strengthening policy and technical frameworks for primary pandemic prevention at wildlife trade interfaces in 3 Latin American countries. So I'm just going to give a little brief background of why we thought this project and approach is really important and valuable. And then I'm going to pass over to my excellent colleagues from the region, and they'll give some specific updates on the approaches, lessons learned, and key results. And I'm happy to connect more and share any of the products from the project with people afterwards. Now. All right. So I think hopefully most of the people on this call already know kind of why wildlife trade is a concern. We know that over 75% of human emerging infectious diseases is zoonotic, and the majority of those zoonotic diseases start with an initial spillover from wildlife. Traded wildlife have been shown to host over 3/4 of known zoonotic viruses, and modeling research suggests that there are hundreds of thousands of unknown zoonotic viruses yet to be discovered. We know that the conditions along live wildlife trade chains and farms and markets are very different to those in natural free-ranging wildlife populations, and they really elevate risk for emergence of and sharing and spillover of pathogens because of the high stress conditions, the density of animals, and the mixing of species that wouldn't normally come into contact with each other. It's really important to note that such pathogens have been detected along both the legal and illegal wildlife trade chains. So those were both a focus for our work. And to note that these viruses include those that don't show any symptoms in wild hosts. So traditional symptomatic surveillance approaches are often not effective for wildlife pathogens and mean that while we can reduce risk from wildlife trade, we can never fully remove the risk of an unknown virus emerging, such as SARS-CoV-2. Sorry, I don't know how to go back. There we go. So addressing health risks from wildlife trade is one component of what's considered prevention at source. And that would be all efforts to prevent the spillover of pathogens and subsequent disease from wildlife to humans or other animals from happening in the first place. And there's been several papers come out in the last few years since COVID emerged, demonstrating that 3 key pandemic prevention actions would cost less than a 20th of the value of life lost each year to emerging viral diseases. So there's clearly an economic value, but also a massive value in terms of reducing loss from mortality and well-being. And so wildlife trade, better management of wildlife trade, is one of those 3 actions. And then beyond zoonoses, it's also important to consider that wildlife trade increases the risk for emergence of diseases that can threaten wildlife, such as chytrid disease is thought to have been partially spread through wildlife trade and amphibians. We know it can threaten domestic animals. We've seen through African swine fever and other pathogens emerging, and that can threaten agricultural economies as well as food security for vulnerable rural populations. So, and then beyond pathogen emergence, of course, wildlife trade threatens biodiversity, and loss of key species can risk cascading ecological impacts and associated landscape level health implications. So WCS is a prevention-focused organization. We work to save wildlife and wild places around the world, and we have programs in over 50 countries where we work closely with government, civil society, and Indigenous and local communities. And in addition to those in-country programs, we also have a dedicated health program, a counter-wildlife trafficking program, and a policy program. So as such, this project was a very good fit for our priorities. So we combine our counter-wildlife trafficking, health, and policy expertise and working closely with our in-country teams in Bolivia, Peru, and Guatemala. These countries were selected. There's many that we work in which are relevant for this approach, but they're highly biodiverse countries that we've worked in for many years on health and counter wildlife trafficking. They have still significant volumes of wildlife trade, but they also have a government commitment, and we have partnerships with the government to address trade, trafficking, and wildlife health issues. So we work to address behaviors, practices, and policies along wildlife trade chains, and it's really important to consider these chains from the origin and source through middlemen to these trade hubs and urban areas and consumers, which are often the highest risk for recombination, sharing, and shedding of viruses. And currently, many countries' adequate data and analysis of these trade chains and drivers and behaviors really limits evidence-driven policy frameworks, legislative approaches. So we work on this project to elevate understanding of those dynamics and critical control points, and then to help inform policy revisions and technical documents to strengthen primary pandemic prevention in these countries. And Giovanna, our regional CWT program manager for the Andes, Amazon, Orinoco region, is just going to give you some background on our approach and the key results of the consultations we conducted first.
Thank you, Lucy. Hello, everyone. Thanks for being part of this presentation. Yes, today I'm going to talk about very brief information about the problem and the key challenge and what was the approach that we had under this project. Next, please. Well, here in the region, in general, in Latin America, we have different key challenges. Relate illegal wildlife trafficking. There are different dynamics, trends, approach that our governments and the civil society trying to fight this problem. There is a complex and poor understand, and also there are different complex legal framework here in our region. In addition, we recognize there are different type of environmental crimes that are affecting the nature and also the wildlife. And one of these problems is caused under the wildlife trafficking. We recognize also there are different efforts implemented by our authorities on other different actors as civil society, but there are different low capacity in key enforcement and judicial agencies to combat wildlife trafficking effectively. In addition, the wildlife trafficking frequently occurs in contact with other serious crime that is affecting on different parts in Latin America in general. Next, please. As Lucy mentioned, trying to face this type of challenge that we identify in different countries in Latin America, we, in coordination with the Alliance, we developed this idea to implement this project to strengthen the policy framework for primary pandemic prevention and wildlife trade interfaces. The project includes 3 activities, and we had around 14 months to implement this project. The main actors that we considered to implement this project was the government sector. But at the beginning, we decided to, as part of the activity 1, to understand more about the problem and about the needs and about the challenges that we need to face using the time that we have to implement the project. At the beginning, we surveyed 42 key actors through interviews, workshops across Bolivia, Guatemala, and Peru. And that includes governmental and non-governmental actors. Next, please. As part of the results that we obtained after this previous understanding process is that the main drivers of wildlife trade in the region include pets uses, medicine uses, and food uses in different, and the countries have different forms to record this type of uses, but the main issues that include these 3. Next, please. As I mentioned, that the project has 3 main activities. The first one was on the understanding process. The second one was to try to review the results that we obtained as part of the activity number 1, in coordination with the government partners to create a country-specific need list to address these key gaps identified to reduce health risks from wildlife trade. As part of the activity 3, we support with expert consultancies to address the country identified short-term gaps. These expert consultancies came from the Alliance, so our colleagues from Bolivia, Guatemala, and Peru are going to present the results that they have to develop with these consultancies. Next, please. As part of the priorities that we have identified on the process of this project implementation include short-term priorities and long-term priorities. During this time of the project implementation, and with the support for these consultancies, we try to bring support on different actions based to work at the short-term priorities. That includes the identification of zoonosis risk in wildlife uses and risk interfaces. For example, working with the one interfaces that have in rescue centers. In addition, to increase the knowledge about zoonosis and strengthen the capacity related biosecurity issues. And the proposal would include to develop different protocols. In addition, one of the another short-term priorities include identifying needs and actions to strengthen wildlife import and export requirements, trying to understand the needs and the next steps to improve the actions to relate the health aspects. Finally, we identify also the needs to develop different proposals for regulation of measures for the prevention, mitigation, and control of zoonotic disease associated with illegal wildlife trafficking. All of these short-term priorities was developed in different countries, but based on the priorities that the countries identified. Next, please. That's part of that is the short summary that I present. And next, I would like to introduce my colleague Fabiola Suarez. She's the technical specialist on counter wildlife trafficking in Bolivia. Please, Fabiola, the floor is yours.
Thank you, Giovanna. Good morning to all of you from Bolivia. My name is Fabiola Suarez. I'm a veterinarian and I work as a technical specialist on counter wildlife trafficking at WCS. And I would like to thank you all for your interest in this webinar. I will now to present the technical and informational gaps that we have been identified within the framework of the project that Giovanna and Lucy mentioned before, led by WCS, advised by the Alliance, and funded by GIC. The next, please. Illegal wildlife trafficking in Bolivia is a complex criminal activity with deep roots and serious consequences. Like most countries in the region, Bolivia's vast biodiversity makes it a point of origin and transit for wildlife trafficking to domestic and international markets. It's driven primarily by consumer demand for various purposes, such as direct human consumption, meat or medicinal use, pet keeping and collecting, cultural or religious practices, and this dynamic includes the sale of live animals, mainly live animals and offsprings in markets and traveling fairs. And since the pandemic, the supply and the demand, for wildlife, also native and exotic, has emerged on social media. Next, please. Since 2003, international trafficking of jaguar it was the previous. One previous, please.
Sorry, do you want this one?
No, yes. The fangs, please. Yes. Since 2003, international trafficking of jaguar fangs and claws has been uncovered in Bolivia, with international connections pointing to a cross-border business. Okay, the next, please. A key factor that has increased wildlife trafficking in Bolivia, it's a close relationship. It's close relationship with other forms of organized crime, such as drug trafficking, arms trafficking, and even human trafficking. The fight against organized crime by the state has historically focused on drug trafficking, leaving wildlife trafficking with lower priority and attention. Wildlife crimes are also linked to corruption, such as the falsification of documents, including CITES export or import permits, in which public officials may be involved. It is also an open door for the entry of exotic species with the potential to become invasive species. Not only does it threaten species with extinction, but also represents a serious risk to public health as a potential transmitter of zoonosis diseases. The next, please. Considering the latter, the first part of the project was developed between April 2023 and July 2024 through several interviews with 16 institutions, including the Ministry of Environment and Water, the Ministry of Health and Sports, the National Animal Health Service, departmental and municipal governments, the Forestry Police, and wildlife conservation centers, among others. The objective was to understand the perception and context of health risks from wildlife trade and challenge to addressing them. The next, please. Among the main gaps and limiting factors in the combat of wildlife trafficking, we identified that the lack of prioritization and commitment, as there was no institution identified as responsible for addressing any problem associated with the wildlife health at the time of the diagnosis. This includes the Ministry of Health, which addresses zoonotic diseases, and the National Animal Health Service, which addresses farm animal health. However, wildlife health was not considered the responsibility of any institution. Regarding legislative gaps, a review of national legislation identified existing regulations related to wildlife trafficking and public health, but clearly lacked a specific enforceable regulations. Regulations were dispersed, and the entities involved in the One Health approach require a specific regulation to become involved. Finally, since there is no specific regulation, rather it is dispersed and unclear, none of the entities that should participate in a coordinated manner and in fact to do can allocate either economic or human resources because there is no legal figure that identifies the state entity that should provide the preventive technical guidelines which are deficient. The next, please. Considering these gaps, the first activity was the development of a regulation proposal on the prevention, mitigation, and control measures of zoonotic diseases associated with legal trade and illegal trafficking of wildlife. This activity was working jointly with the Ministry of Environment and Water under the leadership of its technical and legal team. The next, please. The regulatory proposal was justified by the need to establish environmental regulations for the prevention, mitigation, and control of zoonotic diseases in legal trade and illegal trafficking of wildlife, and has these objectives. The next, please. And it consists of 31 articles, and 6 chapters, and also have 5 annexes, which we consider very important as the lack of technical guidelines was also a technical gap identified. Next, please. In addition to the development of the regulation, the project made it possible to generate scientific evidence on the zoonotic risk associated with wildlife trafficking to support decision makers in a document called Analysis of Zoonotic Risk in Wildlife Trafficking in Bolivia. This consisted of obtaining a list of the main species trafficked in Bolivia using a database developed by WCS with data from more than 16 institutions. And from this list, another list was obtained with the pathogens, viruses, bacteria, and parasites most commonly reported in those species at the national and regional level. This was done by reviewing bibliography from recognized platforms. Subsequently, a classification was made based on 3 risk levels, high, medium, and low, based on aspects such as the probability of susceptibility, the probability of exposure, and the severity of the disease for the population. The next, please. This table shows a small sample of the results of the risk analysis in reptiles based on activities such as hunting, collection and transportation, sailing, market, consumption, traditional medicine, and pet keeping. This type of analysis was made also conducted for birds, mammals, and amphibians. And as you can see, in the case of hunting, for example, pathogens such as Salmonella can be transmitted through direct contact with fluids with a medium risk, whereas the same pathogen may present a high risk in activities like meat consumption. The next, please. In addition to the risk analysis, a document on passive and active surveillance was developed that establishes the steps for multisectorial coordination for zoonotic pathogen surveillance in Bolivia. The next, please. One of the major gaps was the lack of a tool that allowed for the collection of information on the health status of trafficked wildlife through the entire chain from the rescue onward. So we developed the information and interoperability system for prevention, mitigation, and control of zoonotic disease related to illegal wildlife trafficking, ZIPSOF in Spanish. And a prototype of the system has already been developed and is in the testing phase. The next, please. The immediate response plan, another of the protocols developed and intend to be implemented within the regulation proposal, aims to formalize the surveillance and immediate response network for potential health events involving wildlife rescue from trafficking. Although the country has this type of procedures in place, there are some shortcomings regarding the handling of zoonotic outbreaks in wildlife. The next, please. In this slide, you could see the developed protocols, which as mentioned before, have been another of the major gaps identified. And the next, please. And other outputs of the project include the development of several infographics aimed to preventing zoonosis in the context of wildlife trafficking, well as an operational guide for the identification and management of zoonotic risk associated with wildlife trafficking in Bolivia. The next, please. And as you can see, so many things we have done, but several activities are still necessary, such as the socialization and improvement of the regulation proposal to promote its approval at the level of the Ministry of Environment and Water and the other institutions, continue with the development and implementation of the CITO platform, promote the application of the guidelines established for epidemiological surveillance and the warning plan, socialize the zoonotic notification route at the wildlife interface among all the actors, range surveillance and early attention of zoonosis from wildlife, as well as community surveillance and field investigations. The next, please. So, muchas gracias. Thank you for your time. And I would like to present my colleague Luis Fernando Guerra, who will show the development of the project in Guatemala.
Thanks, Fabiola, and hi, everyone. It's a pleasure to be here to present the results that we have in Guatemala. And as my colleagues said before, we done the same work in the 3 countries. So I will talk about the Guatemala results and a brief introduction to what we do. Next, please. So why Mesoamerica? It's small countries that are in the center of Latin America, but it holds the 5.5% of the plant's biodiversity, and the Maya forest. It's a shared forest between Mexico, Guatemala, and Belize, and it has a lot of threats and a lot of biodiversity also. And one of the major threats is illegal wildlife trafficking. Next, please. So we have a lot of species in this region and different type of use of the wildlife, like for pets, for consumption, for medicine. And it's common to know that the people that has animals in their houses, or also they want to go to these areas to consume some animals because it's like a tradition, but they don't know about the risk of the zoonosis that it could happen if you you have these animals or have contact with these animals. So in Guatemala, we have been working with the One Health approach since 2022 after the pandemic. And we use the platform that we made here in Guatemala with the technicians and different authorities of the ministries. Next, please. And that is the One Health Committee from Guatemala that it helps people from the different ministries of public health, agriculture, environmental ministry, and cooperation, and other partners like NGOs and academy. So we use this platform to visualize the problem, and because some of these activities that the One Health Committee do is not related with wildlife trafficking, but we want to visualize that it's a real problem, and if you want to prevent pandemics, you have to address this problem. So we start working with them, and we use this platform to call the experts who works with wildlife trafficking in the country. Next, please. And these experts were part from different institutions, and also we call people that has contact with wildlife, like the public ministry or the police of environment, and ask them what they think about the problem and what they think that are the main gaps of how we can address this problem of counter wildlife trafficking and risk of zoonosis. Next, please. So we have, I think we need another one before. No? Okay. So we have three main results, and the first one was that there is a gap of knowledge of the people that is in the field. They don't know about the biosecurity or the risk that they have when they manipulate wildlife. The other one is that there is a gap in the coordination agencies because they don't coordinate on trafficking cases. They say that we have in Guatemala, we have a good regulation, the law is okay, but we don't have the protocols to coordinate between the different agencies to have a good communication about the risks. Next, please. So also with these experts, we took the opportunity and use their knowledge about the routes of the traffic and the places that are most common with the traffic. And we made a wildlife trafficking and human rights risk map with all the information that they gave us. So we have like 4 main places that we know that it could be the places that we can focus to work. And next, please. And with these results, we start with 2 different consultancies. The first one was the capacity building consultancy about biosecurity and wildlife handling. We have 4 workshops based on the results of the map. Next, please. And we have manual of biosecurity for the technicians of the different agencies, and where they can look at the concepts about what is disease, what is zoonosis, how can these zoonosis can be transmitted, and the risk of the wildlife management, and how they can protect themselves with biosecurity protocols. Next, please. And for that, we use the map. We make it for regions: is the central region, and the south and the north, and the northwest part of the country. So we held 4 workshops, and we trained 29 people from the different ministries, and we can see that they have different levels of knowledge. So it's very important to start with these workshops, because we can realize that there's a lot of people in the ministries and different agencies that work every day with these risks, but they have to be trained by to know the different risks that they can confront. Next, please. So the next one was a consultancy for integration of the internship procedures and wildlife legislation. As I said before, we have the experts say that we have a good law structure, but it was difficult to coordinate between the different ministries or agencies. So we have this other consultancy with a lawyer that help us to work with how can we can improve the communication between these agencies. Next, please. So this consultant worked with the different agencies, with the lawyers of the different agencies, to look how it can be a good coordination and communication between these agencies. And the proposal was that using the platform of the One Health Committee from Guatemala to create a subcommittee of wildlife trafficking. That it's important because this One Health Committee has another subcommittees, like for example, INR committee or zoonosis committee. So we work with them, and these results have like different protocols of how this subcommittee can work and have this communication, and how they can have meetings between the different agencies, and how they can collaborate in case of a wildlife trafficking case. Next, please. This is the example of the different protocols that it's in the document that it was approved by the agencies. And next, please. And what we learned about this project in the country, that all the countries have strengths and challenges to implement this kind of work. So we have a technical and political will to prevent pandemics in the country, a solid legal foundation, but and also awareness of potential zoonotic risks. But we have challenges like for wildlife trafficking, it's always limited resources, insufficient specialized diagnostic capacity in the country. It's difficult to have this coordination mechanism between the agencies, and also it's necessary to have ongoing training with the people in the field, because 79 people is a small part of the technicians in the field, and to have this information sharing coordination. So thank you very much, and I will pass it to my colleague Paulo, that he is going to talk about the results in Peru.
Thank you, Luis, and hello to everyone. So I will present the results in Peru for these consultancies and the work we have been doing here. Next, please. So in Peru, we have a wildlife trade that is legal, normally international one that is mainly for live animals. Also, there is an international trade for subproducts animals. Wildlife trafficking is also a big problem in Peru. And during this work, we have interviewed several actors in the country and identified the needs here. And mainly are needs on regulations for the One Health policy and legislation. Like government knows and the actor knows that this is important. Also, that the need of coordination mechanism to being able to work towards all the actors in the area, and there is a need on information. There's not that many information about wildlife diseases and how the zoonotic diseases can emerge from these animals. Next, please. And there are some key short-term needs that are mainly about information that we identify about what are the pathogens and the diseases and what is the diagnostic tests and capacities in the country for in the illegal trafficking of wildlife and in the international trade. No? And also we see that in Peru, wildlife is used as food. However, there is no disease risk analysis of diseases in this wildlife trade change. No? Next, please. So, two consultancies were to identify the diseases in rescue centers as a proxy for wildlife trafficking and in international trade. Next. And after a systematic review, interviewing a lot of actors, we found that there is like 165 documents that are relevant to wildlife and wildlife health or zoonotic diseases. However, there is a big gap because there is no any agency that is in charge directly to wildlife health management. No, next, please. Also, we identified a laboratory capacity in the country, and we found like there is all 146 laboratories at national level. We're talking about universities, academies, and private sector. We also have national laboratories. However, if there is these capacities to do some tests across the country, no, not all of them are doing these tests. There is a lack of funding for doing these tests. And sometimes there is no relationship between the ones who wants to know what diseases are happening and the laboratories. No, next, please. And also during the systematic review, we found some diseases across the country in the rescue centers. There's not that many information because from 1993 to 2023, we found that have been recorded 59 events of diseases in 26 documents across the different sectors, inclusive inside of the rescue centers, no? Because we interview a lot of them to know what are the diseases that are happening in these centers. So we can see different, mainly bacteria that are affecting these animals, no? But that doesn't mean that other diseases are happening. It's just a gap of information. No? Next, please. Also, we talking about international trade. Peru exports a lot of, and we evaluate the FOB value to understand how many animals are being exported from Peru. Next, please. And we can see that the exports from Peru go to almost the whole world, different animals for different countries. In import, the back, please. So the main importer is the United States of America. However, it can go also to Africa and Asia, and inclusive Oceania. Next, please. Also, Peru imports a lot of exotic species and some products from these animals. And the interesting thing of these exports and imports is that the countries that imports the animals are the ones who ask for what diagnostics or what are the results. No, there is some countries that have less needs for imports, and there is some that have higher needs for that. No, next, please. So from all the diseases that we found in the systematic review, here I'm showing some of the priority pathogens that can be zoonotic on this wildlife trade in different genera. Next, please. And it goes from Leptospira, rabies, brucellosis, and Salmonella, Echinococcosis, the main ones. No, next, please. And when we do disease risk analysis in PACAMID and wildlife trade system as a proxy, also to understand how a disease risk analysis could be done on these systems of wildlife trade. So the PACAMID, there is the main trade chains are illegal. However, there are some that could be legal, with a sustainable hunting. Next, please. So we understand the wildlife trade comes from the hunting, the transfer of the meat, and the trade in different places, for direct selling or buying. Next, please. We identify some hazards in the different parts of this supply chains, and we understand that during the hunting, probably the hazards identified are bacteria, parasites, and viruses, because the hunters are in direct contact with the animals they hunt. During the transport, there is more, the identified hazard is mainly bacteria, and the people that trade or transport this meat is the one that could be in contact with the bacteria. During the trade, also bacteria are the main hazard, and during the consumption also. So, and we can see here that there is different people that can be exposed to this hazard, depends on what point of the supply chain they are. Next, please. And after we identify the hazard, we did a risk assessment by identify. We did it with a methodology, doing questions to understand what is the probability of this disease, of this pathogen to infect a human. and what are the impacts on human, no? And if it's zoonotic or it's not zoonotic. And we saw that during this risk assessment, the highest risk is on salmonellosis and E. coli and some trichuriasis, no, from bigger parasites. Next, please. And also after this, we did a multi-criteria decision analysis to identify how to mitigate this management, this risk with some management alternatives. And we asked people in the supply chain which one would be more feasible to do, and we also analyze what are the health impacts of it, the cost of it, the accessibility, and the acceptance. And the main one was good management practices during the whole supply chain. No, if we improve that, the risk of the zoonotic diseases could drop drastically. Next, please. And during this work that we have done here in Peru, we found some challenges. There is a lack of comprehensive regulations. There is a lack of, as I told you, a cross-sectoral regulatory integration. There is a lack of clarity in the roles of who is in charge of wildlife health management. There is insufficient regulatory framework to address these risks in these supply chains and also in the illegal wildlife, in the illegal wildlife trafficking. No? And there is some deficiency in the infrastructure and in the coordination between the sectors. Who is in charge of what? No? And where we can do, for example, some analysis or what to test. Next, please. And we also found some opportunities because all these gaps make opportunities. And there is an opportunity to strengthen regulation and infrastructure dedicated to wildlife health. It could be a dedicated wildlife health authority. There is conversation about that, and there is finding ways to coordinate between the sectors. There is opportunities of training and coordination from first responders to park rangers and technical staff. There is opportunities to improve the surveillance systems and also the opportunities of health emergencies as catalysts. No, that as example, the avian influenza here in Peru have been a catalyst that drives and structural reforms to understand how to work together. No, and thank you. And I will give it to Lucy.
Thanks, Paolo. I'm just going to give a brief summary with Giovanna as well. Overall, that the project contributed to the Alliance's objectives, focusing on reducing zoonotic spillover risks and enhancing responses. And really this approach to the contact missions to enable us to engage multi-sectoral stakeholders made it much more effective in informed mitigation that is more likely to lead to sustained interventions and policies going forward. And it really enabled us to raise awareness of health risks across the authorities of all the countries and across sectors. And we were able to convene stakeholders from human health, animal health, and environmental health agencies from all three countries together and share results and findings across the countries and have really good discussions on shared concerns and challenges and opportunities and coordination going forward. Giovanna?
Yes, yes. To continue to also finalize the presentation, we would like to mention that as part of the project, we had the opportunity to, and also with the support of different consultancy in coordination with the Alliance, we take some actions on short-term priorities with these three countries in coordination also with the governments. But it's necessary to continue doing and take an action relate the long-term priorities. Most of them priorities are more relate to the approval and implementation of regulation, to identify different roles, competence, in addition to implement different recommendations under the analysis and diagnostic that that the countries identify, and also includes to continue the enforce actions on prevention, mitigation, and control the zoonotic disease associated with illegal wildlife trafficking, primarily in mammals and birds, basically in urban areas, because it's a problem that we have recognized that is ongoing in our region in Latin America. Lucy, please continue.
Yeah, so just to reiterate what Giovanna said, that this was a really great initiative to serve as a catalyst to bring stakeholders together, and it really helped to strengthen overall coordination between the different One Health sectors, both on wildlife trade, but also laying the groundwork for more coordinated prevention response for emerging health risks from wildlife in general going forward. And this was a pretty short mission, so it enabled us to address these short-term priorities, but there are many long-term priorities that need investment to really strengthen and reduce pandemic threats in the countries going forward. And it really highlighted that effective One Health implementation to reduce those health risks needs both technical and government dimensions in all these countries. And in many countries we work in, wildlife health still falls within this gap where it's really no one takes responsibility. So institutionalizing the participation from all the three One Health sectors is really key. Strengthening capacities from the national to the subnational level, given these wildlife trade chains, and from wildlife, the ecosystems in the wild up to the urban trade chains is really important. And considering sustainable financing mechanisms going forward, given the limited resources, and then creating feedback systems to ensure continuous improvement and relevance to novel pathogens and emerging diseases and novel diagnostics we can put in place going forward. So thanks for giving us the time to present. I'm going to stop sharing and hand back over to Annie. Thanks.
Yes, I think now you can hear me. Thank you so much, everyone, for presenting these results. It was very interesting, a lot of information, a lot of work that you've been doing. So that was great to see. Thank you so much. There was a lot of clapping in between the presentation, and I can assure you it was not only me and our timekeeping symbol. So there was a lot of clapping also from everyone in the call, and also a lot of positive resonance here in the chat. It's 2 to 6, at least for me here, but if there are any questions, I still kind of want to offer the floor to the audience to maybe raise their hand and ask maybe 1 or 2 questions if we still have the time. So if there's anyone with a question, then please, now is your opportunity to raise your hand and come forward. We also have had a question if it's possible to share the slides. Maybe, I mean, Lucy, maybe you can let me know if that would, okay, then I can also upload them. Yes, for the event record, where you will also find the recording on the Alliance's website, and WCS can of course also share that as well.
I'll put my email in the chat, Annie, in case people are interested in any of the results or products. We're happy to share those for broader impact as well, if that's helpful.
Amazing. Yes. Yeah, very interesting to see the differences also in each country and the local realities. Well, if there's no questions, then I would say thank you so much. Muchas gracias a todos y todas. And que tengan un buen día. I hope everyone has a great day or a great night, evening, afternoon, morning, wherever you are located. And if there's any follow-up questions, also always, of course, feel free to reach out to the Secretariat, and we can connect you then also to the experts in each country. I think then, thank you so much. And yes, I think that's it. See you next time.
Thanks, Annie. Thanks, Claire.
Thank you so much.
Thanks,
Thank you.
everyone.
Bye bye.
Thank you.
Thank you. Bye. Bye.
And Christine, very, very,
Ciao.
very well done. Thank you.
Thank you.
Thank you.